Dr. Gameli Nodo is here. He's a dentist. He was here last week. Was it last week?
It was
last week. And we looked at issues of dental care in our system. I mean, we just don't like going to see the dentist just for some reasons. But we had a very short time last week. But today we're going to expand on most of the things here. We're looking at dental care or dental diseases. And then we're going to concentrate on the dental caries. And good morning again.
Good morning.
Yes, dental caries, you know, quickly.
So dental caries is one of the most predominant dental conditions in Ghana. This is basically where you would find tooth decay or cavities in your tooth. It occurs as a result of eating foods that turns to supports bacteria. It supports bacteria that stick on your teeth, and with time it will lead to the waste product of the bacteria. The acid will lead to the dissolving of the hard tooth tissue.
So when you eat what
when you eat sticky foods, so like you're talking about toffees, chocolates, killiwilly, cakes, puddings.
And I love cakes.
Yes, but you can be smarter than the bacteria. I mean, if you should do thorough, like after eating, and you should do a swish and swallow, that's use water to wash, rinse your mouth. Maybe you're not at a place where you can use a toothbrush, so you use some water to swish, rinse your mouth and swallow. That should reduce the amount.
Swallow.
Yes.
That's disgusting.
That's not disgusting. It's your own saliva. It's your own food. It's everything.
Well,
is
why
yours.
won't you
spit it out?
Yeah.
No, because we should avoid spitting around. But it's your own.
In your house.
Yes. No, I'm talking about your workplace. You are at school. You are in a marketplace.
But you can go to the washroom and
well, you could do that as well too. But it's just swish and swallow. And then if you should have access to a brush, okay, you wait 30 minutes so that, because as soon as you're eating something sweet, the acidity level of in your mouth increases.
Yeah.
So if you're going to use a brush, it will rather abrade, it will rather cause sensitivity eventually. So you wait for about 30 minutes for the acidity level in your mouth to reduce, and you brush off, not giving the bacteria time to perform their activities.
What will be the reaction? How will you have some serious, apart from the aching? Sometimes it won't ache at all.
Sometimes
it won't ache at all. So how you determine that?
Okay, I have today we're going to do a little bit of imaging visuals for people to see.
Yeah.
But I'm going to start with this. What this is showing is a diagram of the way a normal teeth should look. Can I borrow a pen?
Yeah, you can.
A normal teeth. It has 3 layers. So we have the first layer, the outer layer, which is the enamel, the hard tissue that we see in our mouth. And we have the soft second layer called the dentin. That contains nerve fibers in them. And finally, we have the pulp chamber. That is the main station of a tooth. It has the blood vessels, the lymphatic drainage, and nerve supply there. Now, if you have a cavity, and the cavity is just in the enamel, you will normally have no symptoms. You wouldn't feel anything. So most people tend to ignore it at that stage. If you should go into the second layer, the dentin, what you then do is you start developing sensitivity to hot and cold foods, sweet foods, and you start avoid chewing at that side.
Yeah.
Now, if you should get into the third zone, the pulp, that is where most people rush to the hospital. They cannot sleep because at this point in time, there's abscess occurring at the bottom of the tooth, and then the abscess leads to this pulsating, pounding pain that cannot let them sleep. Whatever they have to do, they get to the dentist to have treatment done. But it shouldn't get to this stage, because at that stage, the treatment modalities are quite painful and more expensive, as opposed to when it's just at the beginning stage, where we could just do a permanent filling straight away if it's only in the enamel. But if you should get into the dentin, we do a temporary filling first, so that the temporary filling contains material that kills the remaining bacteria without getting into the pulp, so that in a month's time you will return, we'll take out the temporary filling and replace it with a permanent filling, which you can chew with it for the rest of your life. unlike if we should get into the pulp, where we would have to do a root canal treatment. So we'll go into the the canal system, remove all the dead bacteria in there, the dead body tissue.
You're speaking a lot of science, you know.
Okay,
so you speak like a lot of English. So
a lot of okay. Yes. So as I'm saying, we'll remove the dead bacteria in there, or the active bacteria as well. Put medication directly into the tooth. Because the blood supply, normally we'll think that when I have tooth decay or something, I should take medication, and just the medication will help me and I'll get well. But not in the case where it gets to the pulp, because the blood supply has been compromised, as well as the amount of blood supply in there is so small that no matter what antibiotic you take, it cannot go and kill the bacteria living in there at this time. So you take medication, it will kill the bacteria in the bone, and then after a while it will re-exacerbate, it will come back stronger if you haven't done either a root canal or an extraction. So this is how you would know whether it's sensitive when you're taking hot and cold food, or when you are in severe pain. You would know then that you
So what's the difference between this and the periodontitis? What's the difference between
periodontitis is actually a second predominant disease condition, dental oral condition in Ghana, where it's the distraction of the supporting system. So I'll show this one more time. The supporting system of a particular tooth, or all the teeth. So you have the bone, the gum, and the ligaments. These are what hold teeth firmly in place. But periodontitis, these bacteria are not interested in eating the tooth. They are interested in living in here and destroying these supporting structures. So with time, the gum, just as you see, this is the beginning of periodontitis, the gum begins to recede, the bone is eaten away, the bacteria in there increases in number, their waste product, dead body tissue, and you tend to develop, from one stage you develop sensitivity, the next stage you develop bad breath.
But what causes that, the receding gums?
The receding gums. So it's the activity of the bacteria. So as they multiply, they destroy the structure. So that's where they tend to reside. Now, evidence has shown, there was this 80-year program that was done in the UK, and the results were released just last 2 years. It showed where they took a group of people, and then these group of people were given the same lifestyle, healthy lifestyle, the food, their diets, their exercises, whereas one group was given an added effect of doing gum treatment every 4 to 6 months. The purpose of this program was to explore on activities that can lengthen one's life. And they found out that those who were given the preventive care lived 40% longer than the rest of the other people. So their further investigation found out that the bacteria that causes gum disease tend to dive into blood vessels in the gums, in the bones. And these blood vessels, when they dive into the blood vessels, they go and live into the blood vessels of the heart and the blood vessels of the brain. So most of the people die from strokes and heart diseases, despite the amount of healthy exercises you try to do. Doing these, not taking care of your gums, doing preventive gum care tends to lead to these conditions.
But what's this one? This procedure?
So this is all images about caries, where you could see it. Now at this stage is showing that it does not affect only children, it affects both adults and children. And some people have fillings, but there are caries next to it. Somebody may think, I've had a filling, so I shouldn't have, why should there be a cavity? This is a recurrent caries. So we put this image up to show all these. You could see the cavity in the abscess on the upper tooth, and a child as well as an adult being affected. Now, the type of restoration, if we've done, after doing the temporary filling and you've come back in a month, these are permanent restorations. The left side shows the old type of restoration, that's the amalgam, the silver type, which used to be used in the past, but currently we are using the composite, which is, so it's the same tooth that has been filled on the right side, but we use composite. This is a tooth-colored restorative material that makes it more natural. And you can see the chipped tooth on the right side of this, but we build it up with the tooth-colored material, and the person, this did not enter into the pulp, and it went a little into the dentin, so it's not a complicated fracture, and you can just simply build it. Now, if you should get to the stage of the pulp, the cavity has gone all the way into the pulp chamber. This is the root canal process, a very basic image of it. We go into the canals, we clean it out. You can see the file showing that we do some work into the canals, and then the last stage shows we seal it up with a material. It's all under local anesthesia. The patient doesn't feel pain during the treatment.
Like a hammer?
No, it's not like a hammer. It's a hand file. Now, this is to show that no matter how destroyed the tooth is, there is a possibility of saving it. But it means you should be able to afford the treatment, or you should have the time necessary. Because this tooth, ideally, people will extract it, but it shows stages where it's been cleaned. It shows an x-ray that the root canal has been done, a post has been put in, and a core has been built around to restore the tooth. Because if you look at it, a large chunk of the tooth was, natural tooth tissue was taken out. So the core around it, around the post, which is like building iron rods and putting cement around it. That is how to give it the strong support to finally put a crown on that tooth. And these are crowns. These are the restorations that have metal underneath, and it has the exterior part has porcelain, so it makes it look just like your tooth. And when you put this crown on the root canal treated tooth, the tooth is safe for the rest of the person's life. That is, if the root canal was done very well.
But I know this friend, I mean, he has very white teeth, but suffering from that. Is it because, you know, the way they brush the teeth is wrong? You know, specific way of brushing the teeth? Because very white teeth,
very white teeth.
Have some problems with it.
Okay. Naturally, when somebody should have very white teeth, that is a gift that the person has gotten from birth. But if a person is not doing the right things, if the person is using the wrong method of brushing, as you say, you would then cause yourself the infliction that the bacteria.
Up, down, down, up, sideways?
So there are several ways we do the brushing. We do. Unfortunately, I didn't bring anything to show that I should have. But I thought we were going to focus a little bit more on the dental caries, so that's why I skipped. But then it's basically up and down motion, not back and forth motion. I apologize to viewers. I'll do it next time I'm on and show proper way. But it's up and down motion with a medium textured toothbrush.
Not a hard.
Not a hard. So. Your children from age 1 to 7, they are using very soft, extra soft toothbrushes.
Would that discolor the tooth? Because if it's softer and then it can't really clean well, but if it's hard.
No, actually, it's not about the strength, it's about the frequency. Because if you brush first thing in the morning, last thing at night, the frequency of the brushing ensures there's thorough cleansing. It's about the active ingredient in the toothpaste as well. Has it got fluoride in it? Has it got certain things that will promote prevention of sensitivity? Has it got a desensitizing agent in it? So these things are something that you should know as personally. So what I would always suggest to somebody from age 1 to age 12, the children should use medium soft textured toothbrush. From age 12 to adult, medium textured toothbrush. If the person is a smoker, then the person will go ahead and change from medium texture to hard, the smoker's brush. Because what happens is when you use the smoker's brush, you destroy your gums. You traumatize it with a scrubbing effect. So the same effect of the receding gums, what the bacteria cause, you are now doing it to yourself. Unlike smokers, when smokers smoke, they turn to, the heat tend to harden the gum. So it's like somebody who weeds, right? The person has thick palms, But you or somebody who deals with fire and cooking, the person can resist heat. But somebody who hasn't done it before, initially you go through trauma. And this is what happens if you keep cutting yourself with a hard toothbrush.
So what of the traditional people who use the palm stalk and those things? What does it do? Is it healthy?
It's healthy. The palm stalk, remember, they pound it into a salt and they add charcoal. It's healthy because of the you remember that I keep on thinking that, you know, if you should use black, right, and you should scrape it, you should keep brushing.
Very white.
No, when you take it off, your first impression is, oh, it's become whiter because it was black. Now it's whiter. Do you understand? But it's really not changing much. Maybe there's some amount of baking soda in there that it's improving. But the thing there is there's no fluoride in the charcoal. So indeed, after you've done that, after you've chewed your chewing stick and all that, please get fluoride and brush, because the fluoride cannot be substituted by anything. There are some toothpaste like Youthmol that people use that hasn't got fluoride. I have clients who, after pregnancy, because the fluoride supports the calcium. It reduces this ability for the calcium to be dissolved or be absorbed out of the blood of the tooth. Some clients who do not use that, after delivery, they tend to lose teeth. Why? Because the baby sucked so much calcium and the body looks for wherever it can get calcium, and the teeth has a supply. But if you're using a fluoride-containing toothpaste, then it will not suck the fluoride from your teeth. It will suck it from other places, but you will not lose your teeth eventually. So some people tend to lose their teeth.
But those in the what do you call it, the rural areas don't really have anything like that, you know, using fluoride and all. But let's just go back to the pictures. If we could have it on the screen. Yeah.
This a completion. This a tooth an anterior tooth that had a root canal done and the crown fitted on. Now let's just say you've lost the tooth because nothing could be done to save it. This is a bridge. It's a combination of crowns together. So the middle tooth is being replaced here. So the middle tooth is being attached to the tooth on the left and the tooth on the right. Next slide. So if on the next slide, you would see a preparation that has been done, so that you can see that the middle tooth is missing. So the preparation on the left is carrying is supporting the middle tooth, and the preparation on the right is supporting the middle tooth, and it's cemented. So if it's seated on these two preparation of the teeth, and it's seated, and it's a permanent restoration. It's called a porcelain fused to metal bridge. This is not a type of restoration that falls out. It's there permanently, and the person has replaced the tooth for life. This is one of the recommended way of replacing your missing teeth if you can afford the treatment. Now, this is currently the most advanced permanent way of replacing a missing teeth.
They drill it? I mean,
it's called a titanium screw. This is a dental implant. So you could see a titanium screw, which is biocompatible. That means it grows with the body. The bone fuses and grows into it, and it stays there permanently. So we do not touch any of the standing teeth. We do not cut any of the standing teeth. We drill into it, and then after it's healed, we replace the missing part, the exposed part, with a crown. You will not see the metal part as you see on the root. You wouldn't see. It's just shown like this to see that yes,
there's something in there.
Yes, but you just see your normal teeth, just as how you see them.
Isn't that painful? I mean,
all treatments are done under anesthesia. Currently,
after that, maybe weeks, and then will you see?
You know, if you see developed countries now, people are doing what they call extreme cosmetic makeover. All these extreme cosmetic makeover tends to cause some. Excuse me.
Sorry.
Tend to cause some level of pain. It tends to cause some level of pain, but the results tend to be better. intention. I think I've spoken so much that I think I've spoken so much.
You have. Let's look at this very quite, interesting. Bleaching of the teeth. People put in a lot of things in their mouth just to whiten it. Is that healthy?
Initially, we had challenges to bleaching, to teeth whitening. Initially, we are not sure about how to go about the whole process. But currently, we've developed ways of going about the whole process without much complications. The client will be put under a toothpaste that will cause desensitizing for about 2 weeks. This will be done after we have done thorough cleaning, so we've removed all bacteria in the mouth. So that is the first important thing. We've done a thorough cleaning. We've given the person a desensitizing toothpaste to use at home for 2 weeks. And when it's used at home for 2 weeks, what happens next is we would have taken a measurement for building a take-home bleaching tray. So this take-home bleaching tray, the person will come to the office where we use a dentist-regulated active bleaching. The concentration of the bleaching agent, so it's in a controlled environment. We protect the gums, we are sucking, it's a controlled environment, and we do the active bleaching, which should take roughly about an hour. The color of the tooth will move from, if let's say 1 is dark and 10 is white, the color of the tooth will move from like 1 to about 3 or 4 in office. Then we give you the take-home the same day.
Okay.
Then we give you the take-home bleaching tray with the take-home bleaching set, which has less active ingredients than the one in the office, so that in an uncontrolled environment it causes less harm. And you use it for 2 more weeks at home, and it moves from 3 to 4 to all the way to 10, and you gain the whiteness.
But frequently, doing it all the time,
all the
is
time.
It healthy?
Is it healthy?
What does it do to you?
A lot of people do things that are not right for them, but now that we turn to learn how to ameliorate or prevent the complications. So it should be done, yes. Bleaching is not a one-time procedure. You will do it and you keep doing it. If you are somebody in an industry that needs that, yes, you save towards it, you have attention towards it. It is expensive. All cosmetic procedures are expensive. Do you understand? So if you have good white teeth, all you need to do is preventive care, gum treatment, fillings, repair. But if your industry needs you to do that, then you put your package aside to ensure. If it's not white, if it's some people have really marvelous arrangement of teeth. So
do I have it?
You do. So if you want, all you need to do is whitening. But some people have, the arrangements are not that good. So then to get a more permanent and well constructed, we do what we call veneers. There's also another way of, we do preparation on every single tooth, from which we see when we smile, your premolar to your premolar, or canine to canine. And then what we showed as the crowns, but this is veneers, purposely to fix and arrange and recontour to give people beautiful smiles as it should. And that is a permanent restoration. Now, this is saying that when somebody meets you, the first thing the person sees is your smile, 47%, whereas the other things follow. So would you want to be like this, where people, so 47% is your smile, your eyes is 31%, your smell is 11, clothes 7, and hair is 4. So your smile carries a lot of weight for first impressions.
Yeah.
So like the lady as you see in the next slide, would you want to be seen and noticed with that smile? You know, this is somebody you would want to listen to, hear what the person has to say. Anytime the person is coming to you, surprise the person is coming with some wisdom. But you can be so wise or wherever, but unlike this, nobody will pay attention to you. And this is due to years of neglect. Years of neglect, and the person, this is not something anybody wants to have.
I think you should come again. You should come again soon. So the number to reach on Dr. Gameli is 020-630-1950. Again, 020-630-1950 or 0302-907078, right?
901-078.
Okay, so sorry. 0302-901-078. So 0302-901-078. Thank you so much. You should come again. So
I'll do that.
Because I wanted us to look at, some other areas.
Oh, yes.
So
wonderful.
You should come again.
Thank you for having me.
All right, you're welcome, Stan. And so you've been watching the AM show. We'll see you tomorrow morning. My name is Nana Akwesakne. That was with Roland Walker. Have a nice day. Bye.